Greetings, people of Earth. First thing you need to do is to see what type of medicine you have. Testosterone, 200 milligrams per milliliter. Right there, it says for intramuscular use only, which is the type or the method you use to inject it into your body. The second thing you're going to do is check to make sure it's not expired. Next, you're going to inspect the testosterone. Now, it's best to hold it up to a light, so what you need to inspect it for is any crystallization or discrepancies in color. If it has crystals in it, if you see that it's like crystallized or solidified, that probably means that it's too cold. So what you can do is put it in some warm water for a bit and just wait until the crystals go away. The next step is to make sure that you have all your supplies. A syringe, which I have. You need your needles. You're also gonna need a Band-Aid. If you bleed like a lot, you should probably get some gauze. You also need at least one alcohol wipe. And if you only have one, make sure you use it on your leg. So now what you're gonna do is wash your hands. And the next thing you're gonna do is clean your area. Make sure you're working with a sterile area. Make sure with intramuscular testosterone that you trade off legs. So like if you inject it on your left side one week, you inject it on your right side the next week. The type of syringes I have a needle built into them. And then I also have, this is the thing you use to draw up the medicine from here. And then this is what you use to inject it into your body. Not good to use a needle multiple times. It prevents cross-contamination. Open your alcohol wipe. Vigorously scrub the top of the medication for 15 seconds minimum. Open your syringe. My dosage is 50 milligrams. And if you remember, the math is that this is 200 for one. So this can hold 200 milligrams, but I only need 50. So it would be 1/4 of 200 is 50 milligrams. And 1/4 in decimal form is 0.25. So I'm only going to fill it up to 0.25, which is right about there. It helps to have a place to store these. I have a plastic jug. Write needles on the jug. Pull the needle out, and this is empty. Like we're just pulling this out until it hits 0.25. And the air in here is going to be injected into the little medicine thing because this is airtight. And nothing can come out unless something goes in. So double check to make sure you're getting the right amount of medicine, and then you can poke the needle in. Push the air in, so you press down on the syringe, and now the syringe is all the way at the top. And then what you're gonna do is make sure the tip of the needle is completely submerged in the medicine. A fast draw means there's gonna be air bubbles, just like make sure to draw slowly. And the way to get rid of air bubbles too is by holding it. So like draw out more than you need and then hold it upright, hold the needle upright so the air bubbles go to the top, and then push the plunger back in so the excess medicine and air bubbles go back into the medicine jar. Now what needs to happen is this needs to come off. So you twist and pull it off. Now we're getting this. And you're gonna stick that on and kind of twist it. Make sure it's really on there. You wanna seal, guys. So that's the needle that's going into our body. Now is the part where I take my pants off. The way you measure it is, this is your hip bone. This is my hip bone right here. And this is my knee right here. It's about a hand's width from your hip bone down. And then a hand's width from your knee up. In between there is like where you're aiming for. But you don't wanna go for the center because there are arteries running through here. So what you want to do is go for like this chunk of thigh right here. It's like the outer third, but you need the needle to go in straight. So you can't like inject it from the side. You need to go straight up and down. So I normally aim for like right here. Now is when you get your alcohol pad, and you need to give yourself like a big area to work with and scrub that whole area for like 15 or 30 seconds really is the minimum. What you do is you're gonna put your hand and like pull your skin taut. And some people do it like this, or they pull like the area they're gonna inject. I always feel like I'm gonna inject my hand, so I either go like this or like this, you know, to pull forward. So like you can see I have extra skin that's shifting around, and you want to pull it like really taut. If you picture, you know, the skin is sitting on top, and then there's like the muscle beneath it, and the skin's all bunched up like this. So when you pull it tight, the needle goes in there, and then the skin like sloughs back over, and it hides, when you release at the end, it hides the needle hole, so you bleed less, and the testosterone doesn't come back up. Uncap, if you remember, we're aiming for this area right here. I'm gonna pull it tight, and you wanna go straight up and down. You're gonna pull it tight, all the way in. It doesn't hurt, make sure the whole thing's in there. Pull and release. Set your needle aside carefully, grab the Band-Aid that you had. So I've got my Batman Band-Aid on there, that's all set. So now all you have to do is dispose of your supplies and clean up. Hope this helped.